on the way for those impacted by Hurricane Dorian, but this time the aid is in the form of improved vision. Our Antoinette Smith joins us live with the latest on this initiative. Good morning, Antoinette.
Good morning, LaDon. That's right. Our next guests have been performing vision outreach programs throughout the Bahamas for some time. And after Hurricane Dorian, these medical professionals of the Ash Eye Institute have only amped up their efforts in providing vision screening and treatment to those impacted by Hurricane Dorian. So joining us in studio this morning is ophthalmologist Dr. Duranda Ash and nurse Audrey Lightburn. Thank you for joining us.
Thank you. Good morning.
So we know since Hurricane Dorian, you guys have been on the ball, working around the clock, trying to provide vision care. Tell us how that's going so far.
It has been going really, really well. We've been into the shelters throughout Nassau, screening and identifying different eye diseases in the various occupants of the shelter. Glaucoma is a preventable cause of blindness. There's no pain. We have diagnosed quite a number of persons who didn't know that they have glaucoma. We've seen diabetics and treated their diabetic eye disease. There are many people who may have needed glasses, and we've provided like over 100 pairs of glasses free of charge. All of this has been free. There are a number of people who will need surgery, and we will provide that as well. So we've been working very intensely. I've had my colleagues come down from various parts of the U.S., ophthalmologists like myself. They've come down and spent a week providing this care, this much needed care, and now there will be at least four eye doctors who will be present for the outreach that will start on Monday and Tuesday here in Nassau at Holy Trinity Hall in Stapleton. And then we'll go to Grand Bahama and be in Grand Bahama on the 9th and 10th at Agape House of Praise. So, you know, now is the time to just come. We will be giving out glasses on the spot, drops that may be needed. We will be providing any other follow-up care that may be needed, as well as eye surgeries. But you must come through this vision screening. And this program is for those persons who were directly impacted by Dorian, those persons in Abaco who were affected, those persons in Grand Bahama who were affected.
All right, so Nurse Lightburn, you are the Dorian Relief Coordinator, yes. And you've seen a lot go on. You've been in and out of the shelters just mobilizing. What is one of the major issues that you've been, in terms of vision, that you've been noticing throughout these screenings, and how are we trying to treat that?
Okay. As Dr. Ash mentioned, we do have quite a few persons that have been discovered to have glaucoma, but we also have a large number of persons with cataracts, and that particular aspect of the care will follow following this second phase of the outreach. But we have had a lot of minor conditions that could turn to be a problem for the persons in the long term, and that is dry eye. More than 50% of the persons have had dry eye syndrome, and so yes, they've received the adequate care in terms of drops, and we've had a few that had minor injuries, conjunctivitis also, and so we have embrace that opportunity really to prevent them from progressing to another level of serious eye complications.
So phase one of this project was going into the shelters, and now you guys are going to be stationed at Holy Trinity to provide vision care to those persons who weren't able to necessarily, who weren't in the shelters. Right. Yes. So what is phase two going to look like? Is it going to be more intense? More focused on the treatment aspect? What's it going to look like?
Well, phase two have been now for us reaching those persons who weren't in the shelters. Phase 2 is also where, based on what we discovered with the screening, providing that follow-up care in an office setting, and then, of course, ultimately surgeries, identifying persons during the necessary workup in preparation for the surgery, and of course the ultimate phase will be when we, provide the surgery and that follow-up care.
Now, those survivors of Hurricane Dorian have been through a whirlwind of experiences, and some of them, as you say, may need more care, more surgery. So how is the Institute making sure that they are able to get this treatment at an affordable cost?
Actually, yes, it's going to be very affordable. Everything is going to be free. Everything is going to be free. I think it's just so important for persons who have been through so much. God has really blessed us in being able to have this expertise, and so the least we can do is share this expertise with those who have been directly impacted from Dorian. So these services will be free, but you have to come through this initial screening process. Mm-hmm. So that's why it's so important that persons who are in Abaco, if you're not actually here, this is a trip that's worth it. Come to Nassau, be a part of this vision screening, because you must come through this avenue in order to get prescription glasses, in order to get any testing, in order to get this free surgery if it's needed. You must come through this initial process.
Nurse Lightburn, when they get to Holy Trinity Church on Monday, what do they need to know? What do they need to do? Is there anything that the patients need to bring?
Yes, it is important that those persons that are coming to the screening ensure that there is a way of verifying that they are actually either out of Grand Bahama or out of Abaco. And they just, for some persons, especially those that don't speak English very well, that they bring some form of identification so that we're able to register them properly, because as the phases of the program roll out, we would need to be able to verify that they are indeed from those islands, because the partners in the program are actually providing the resources, and so they want to make sure that the resources are actually being directed in the pathway that it has been earmarked for. And so the general Bahamian populace, we do offer screening at other times, but on this occasion, it's just for the Dorian evacuees and those affected that may not have left the islands. And so that is why we went into the shelters, and we're now having those persons that were not in the shelters come to us, because we want to capture everyone that needs the help. Now, many persons that are from those areas may think, well, oh, my eyes are fine, I don't need the help. But I assure you, we have encouraged some persons, come on, take up this opportunity. And through them taking it up, they discovered, after all, I do have a problem, I do have a need. Because oftentimes, like the glaucoma, it's not manifested unless persons have difficulty seeing, they feel their eyes are okay, but that's not always the case.
All right, tell us once again where we can find you.
Okay, the screenings will be in Nassau Monday and Tuesday at the Holy Trinity Center in Stapleton Gardens. We start at 9 a.m. and end at 5. And on Thursday and Friday, we will be at the Agape House in Pioneers Loop in Grand Bahama. And again, we encourage persons in Grand Bahama to bring some form of identification so that we can ensure that we are entering their names and their demographic data appropriately for future use.
Well, first in Nassau and next in Grand Bahama, the Ash Eye Institute is one step closer to providing vision care to those affected by Hurricane Dorian. We're going to toss it back to you in the studio, LaDon.